And we are back with Dr. Linda Nicolotti with Atrium Wake Forest Baptist Health, caring for your mental health during a natural disaster. Someone has asked, will mental health professionals be going to Western North Carolina to help those first responders and other people like the kids and the parents and all that?
There will be mental health providers going to those locations. There are trained mental health providers that are part of disaster response teams who get deployed to locations as soon as it's safe to do so. So, yes, there will be extra support available as soon as it's safe for them to get there, or as soon as they're able to do phone or telehealth conferences with people.
Yeah, I imagine that not just the kids and the families, but also too, like that person said, the first responders will also need some people to kind of decompress with and talk with. And I think all of us probably need just a little bit of decompression with all of that.
It's important to have a support system and people that you can talk to. So, people that maybe understand what you've gone through, and professionals can be really helpful in navigating the trauma around experiencing some of these events.
And I think sometimes we as friends or family or even parents sometimes don't know the words to say. We don't have to have the perfect words to say.
No, you don't have to have the perfect words. I think just, inviting someone to talk to you, being a good listener, validating their feelings can go a really long way in being helpful.
All right, and so with this whole thing of disaster and the trauma that is surrounding all of this, what are your final thoughts on helping our kids and helping one another?
Yeah, be there for one another, take things day by day. Try to look for the silver lining, focus on the help that's being given, and the support that you have. Try to limit social media exposure to repeated images of, the flooding and things that might be distressing. And seek out support, have people that you can talk to and lean on.
And maybe that's not the parent, maybe it's an older sibling, maybe it's a grandma, maybe it's somebody else. You just got to find the right fit for whoever that is. Thank you so much, Dr. Nicolotti, for joining us. We appreciate that. And if you missed any of our conversation, you'd like to hear part of it again, you can find all this information in our website. It's in the Who Wants to Know section.